Hi, my name is Liz Castillo, and this is my video on the axial skeleton. I'm in Professor Key's first session of AMP and with Kaiser. The axial skeleton has 80 bones, and it forms the longitudinal axis of the body, and it consists of the skull, the bones associated with the skull, and the vertebral column and thoracic cage. The frontal bone forms the anterior portion of the cranium and form the roof of the orbits of the eye. And it articulates with the two parietal bones. The parietal bones, these form much of the superior and lateral surfaces of the cranium, and the occipital bone forms much of the inferior and posterior and inferior portion of the surface of the skull. The external occipital protuberance, which is this bump seen midline in the inferior surface, it serves as the attachment point of the ligament that supports our head and helps to stabilize the vertebrae of the neck. Directly inferior to that is the external occipital crest. The temporal bone here. The temporal bone forms part of both lateral walls. So there's two, one, two, both lateral walls, and it articulates with the zygomatic bone. The mastoid process here is the attachment site for muscles that rotate or extend the head. The styloid process, here and here, the styloid process is the near, of course, the base of the mastoid process, and it's the attachment site for ligaments that support the hyoid bone. The external acoustic meatus here is on the lateral surface, and it ends at the tympanic membrane and channels sound waves to the eardrum. The squamous portion of the temporal bone is here, and it borders it's at the anterior portion of the temporal bone, and it is very close to the squamous suture. So we'll take off the calvarium, and I'll show you the petrous part of the temporal bone on the inside. And this is the petrous portion of the temporal bone here, and it houses the internal acoustic meatus, and it begins on the medial surface. It carries blood vessels and nerves to the inner ear. The sphenoid bone, this area here, the sphenoid bone, it is called the keystone of the cranium because it articulates with all of the other bones of the skull. There are three major depressions or fossae. We have the anterior fossae, the medial, and the posterior fossa. The lesser wing of the sphenoid is here and here. This is the lesser wing. It's anterior. And then we have the greater wing here, and the optic canals. These canals permit the passage of the optic nerves from the eyes to the brain. The sella turcica is a saddle-shaped bone here, and it houses the pituitary gland in this depression called the hypophyseal fossa. The ethmoid bone has three parts, and it has the cribriform plate on either side, the anterior or superior, I should say, portion, and then, of course, the perpendicular plate. The cristogalli is the bony ridge that we see, and it projects superior to the cribriform plate on either side. And it's the anchor point for the meninges of the brain. The sutures of the skull, we have the coronal suture, and that articulates with both parietal bones. And then we have the sagittal suture, which articulates with either of the parietal bones, and the lambdoid suture. And then we have the squamous suture, which is here at the surface of the temporal bone, and it articulates with the parietal bone. Okay, so there are 14 facial bones, and they're irregular and they help to shape the face. We have the maxilla, and then we have the little bumpy ridges on the maxilla, which are the alveolar processes, and those help to support and hold the teeth. We have the zygomatic bone, and the zygomatic arch is made up of the temporal zygomatic process and the zygomatic temporal processes that make the zygomatic arch. We have the bony nasal septum, and that is made of the base bone, the small base bone, which is the vomer, and the top portion or the anterior portion of that is the sphenoid, the ethmoid perpendicular plate, right in here. These are the nasal bones. Inside of the nasal area here, we have the inferior nasal conchae, sometimes called turbinates, because they cause air turbulence, warm and cool air as we breathe it in, and it filters the air with its mucous membranes. The mandible is the largest part of the facial bones. It's also the strongest and the heaviest. The body of the bone, the mandible, is the largest part, and then we have the angle, which is in between the body and the ramus bone. We have the mandibular condyle and the mandibular notch, and the coronoid process, which is the site for the muscles that help us to close our jaw. And this is the temporal mandibular joint, which attaches from the condylar process to this area here, which I can't remember. Anyway, it's the attachment site for the muscle that helps us to move our jaw. Okay, so now we're going to go to the vertebral column. We have 4 curves in the vertebral column. I apologize, my skeleton is falling apart. We have the cervical curve, which is concave, and that's C1 through 7. We have the thoracic curve, which is T1 through 12, and convex. And then we have the lumbar curve, which is also concave, and it is L1 through 5. The cervical vertebrae have the largest foramen, which is the hole in the middle that houses the spinal cord. And each one of them has a transverse process. The very top, or C1 vertebrae, is unusual in the fact that it does not have a spinous process, and it has the largest of the vertebral foramen. The cervical spine, again C1, 2, 3, 4, 5, 6, and 7. They have they're the smallest of the vertebrae, and we have here T1 through 12, and T1 through 12, their spinous processes point inferiorly, and the transverse processes are short and thick, and they all have facets which attach the ribs to them, and except for T11 and 12. The intervertebral foramen are these little holes in between, and these allow for passage of blood vessels and nerves to and from the spinal column. The centrum of the vertebral body, that's the centrum or the vertebral body here, this thick portion. The intervertebral discs are the little fibrous fibrocartilage that are in between and adjacent to each of the vertebral bodies. Then we have the lumbar vertebrae, L1 through 5. These all look like little moose, and the thoracic vertebrae kind of all look like little giraffe, which are kind of cute. So it's kind of a good way to be able to tell them apart. Anyway, the lumbar vertebrae are the largest of the vertebrae, and they support most of the weight of the column, the spinal column. Their vertebral processes are thick and short. We have the sacrum, L1, S1 through S5, and this median crest is caused by the formation of the fusing of the spinous processes. And then we have the coccyx bone, C1 through 4. It's usually 4 bones, but sometimes there can be a couple more, and they fuse between the ages of between 20 and 30, usually around 26. The sacrum in the female is shorter and wider, and in the male it's longer and more slender. The coccyx bone in the female points anterior, and in the male it points anterior, in the female it points inferior. The thoracic cage, which is falling apart again, I apologize. It houses many of our and protects and supports the thoracic cage, the internal organs it supports, the ribs and the sternum. They serve the function of course, the protection and support. The adult sternum or breastbone lies in between and articulates with the two clavicles, and mine's missing. The widest portion is the manubrium, and in between them right here is the jugular notch. The manubrium articulates with the sternal body, which is tongue-shaped, and ends inferior with the xiphoid process. The ribs elongate and curve, and they originate on or between thoracic vertebrae, and they end in the wall. The ribs 1 through 7, 1, 2, 3, 4, 5, 6, 7 are the true ribs, or the vertebral sternal ribs, and each of them are connected to the sternum. The vertebral chondral ribs are the false ribs, which are ribs 8 through 12. 8, 9, 10, 11, 12. These are the false ribs, and they're called this because they do not attach to the sternum directly. The last two, 11 and 12, are called the floating ribs because they do not connect to the vertebral rib or attach to the vertebrae. And that's the end of my video. Thank you.